Good morning, sir. I'm Jessamine Serrano, your nurse for today. Today, we will going to perform hair care shampooing. So, first step is I'm going to apply gloves, clean gloves. After applying gloves, we will inspect the hair and scalp of the patient before shampoo. So, as I can see on his head, there's no any lesions or blood on his head. Then next is, you can apply gown or lab gown if necessary. Ensure that there's no contraindication in the procedure. Number 3 is, identify the patient using at least 2 identifiers. So, sir, what is your name? When is your birthday, sir?
September 23, 2003.
Okay, sir. Then next is assess the environment for safety. So, as you can see, the patient is already safe on his position. So, then next is explain the procedure to the patient. Sir, ang gagawin ko po sa inyo is sa shampoo ko yung buhok nyo, iwawash ko, then i-rinse and dry. Then next is I will remove my gloves. Dispose it to the proper receptacle. Then next is I will perform hand hygiene. So my hand is not visibly soiled. So I will just put alcohol. Then next is assemble the equipments on the side beds. So these are the equipments. Towel. We need 2 towels. Then let's assume that this is the waterproof pad. Clean gloves. Dry shampoo. Shower cap. And the shampoo. And of course the base. And the comb. So the next step is we will provide privacy for the patient to be comfortable and to boost his confidence. Then let's assume that I already closed the curtains or door. Then next is let's raise the bed on working height. So let's assume that I already raised the bed. Then let's lower the rail. So let's assume that I already lowered the rail. Then next step is shampoo bed bound the patient using shampoo board. The next step is we will apply clean gloves. After applying clean gloves, let's apply the waterproof pad under the head, neck, and shoulder of the patient. So let's assume that this is waterproof pad. So sir, can you move and I will assist you, sir. I will just apply this waterproof pad under. Under you. After applying the waterproof pad under the head, neck, and shoulder of the patient, place the shampoo board under the patient. So let's assume that this is the shampoo board. Assist the patient on his proper position. So sir, can you move and I will assist you. Move. Sige pa, sir. Then place the basin under the head of the patient. Ensure the spout extend beyond under the mattress to avoid water spill. Then next is place the towel under the patient's neck and place the bath towel over the patient's shoulder. So this first towel is on the patient's neck. So can you move? Then this one is over the patient's shoulder. Then next is brush and comb the patient's hair. So, next is ask the patient to hold cloth or wash towel over his eyes. So sir, can you hold this towel to protect your eyes? Sige na. Yan. Yan lang, yan. Yan. Isa lang. Then next is test the water temperature. So the temperature of the water is okay. So next is pour the water on the head of the patient. Pour the water on the head of the patient until wet. You can apply hydrogen peroxide if there any blood on his head. So I think there's no blood on his head, so I will not apply hydrogen peroxide. And also for saline, I will not apply that because there's no any blood on his head. So next is I will now apply shampoo on the head of this patient. So get the appropriate amount, then apply this on the hair of the patient. Work up ladder with both hands, started at the hairline and work towards the neck. And next is lift head slightly to wash the back of the head. Then shampoo the side of the head. And massage the scalp by applying pressure with fingers. That is okay now. Now it's okay, and let's rinse it with water. Ensure that water drain into basin. Repeated rinsing until free of soap. So I will rinse it. Make sure that you rinse it properly. Then next is ask the patient if you want to use conditioner or any cream on his hair. Sir, do you want to use conditioner?
No.
Okay, sir. So the patient doesn't want to use conditioner, so let's proceed to the next procedure. Then next is wrap the patient head with bath towel. And next is dry patient face with washcloth. So using this washcloth, I will dry the patient face. And also dry any moisture along neck and shoulder. The next is I will now remove the basin. Then dry the patient's hair using the second towel. Then next is comb the patient hair. Then ask the patient if you want to use dryer. So sir, do you want to use dryer on your hair?
No.
Okay sir. I will just comb your hair. Comb the hair to remove the tangler. So after that, apply any oil or conditioner on the patient's head if desired. So sir, do you want to apply oil or conditioner to your hair?
No.
Okay sir. So next is gagamit po tayo ng malalaking space sa supply kung yung patient is kulot po. Since the patient ay hindi kulot, hindi na po tayo gagamit yun. Then next is remove the towel. And the waterproof pad. Assist the patient on his proper position. So, I will use it. And finish styling his hair. So, then next is left the call light within reach. So, I will just put this call light beside your bed, sir. So, if you need anything else, you can press the call light to call us. Then next is dispose the supplies. Put this on the laundry bag. Then remove the gloves and dispose it to the proper receptacle. Then now perform hand hygiene. Then next is we will now proceed to another type of shampooing. So, shampoo the patient with disposable shampoo product. The next step is position the patient on the proper position. So, ma'am, I will assist you to up. Now, we will apply clean gloves. Then next is we will comb the patient's hair to remove tangle. Then next, after combing the hair of the patient, let's open this package or the dry shampoo, then apply to the patient hair. Then next is apply cap. Ensure that the patient hair is beneath the cap. is massage hair through cup. Then ensure that the cup is fitting on his head. Ito lang gaya. Next is remove the cup on the patient head. Then dispose it to the proper receptacle. Then next is ask the patient if she wants to dry her hair. So ma'am, do you want to dry your hair? Yes. Okay ma'am. So I will use towel to dry her hair. So after that, brush the patient hair. Then next is remove gloves. And discard it to the proper receptacle. Then perform hand hygiene. And assist the patient on her proper position. So ma'am, can you move? I will assist you to your proper position. So, ma'am, do you feel comfortable now? Yes. Okay, ma'am. Then next is inspect the condition of the hair and scalp of the patient. So, as I can see, the condition of the hair and scalp of the patient is good. So, next is ask the patient how to reduce the risk of exposure to lice. So, ma'am, how can you reduce the risk of exposure to lice?
Kailangan ko maligo araw-araw.
Okay, ma'am, very good. So, that's all for today. I hope you've learned something. So, bye-bye.